take it from here, if you would.
Well, thank you, Jana, and good morning to everybody on the call. We had over 150 folks register. So good morning to Hawaii and the West Coast, and good afternoon to Midwest East Coast friends and colleagues. I'm Lori Connors-Tadros. I'm the project director of the Center on Enhancing Early Learning Outcomes. I do that in partnership with Steve Barnett and others at the National Institute for Early Education Research, Jana, Diane, and others at EDC, and Tom Schultz at CCSSO. We are part of the Comprehensive Center Network that is funded by the U.S. Department of Education, and our charge is to build the capacity of state education agencies to implement policy for children birth to third grade. And we do that, as I said, in partnership with a variety of other state and national organizations. Really excited today to share with you this research that was really born out of one of those partnerships, and it reflects the technical assistance that we provide. Our technical assistance is very responsive to the needs of state education agencies and state early learning agencies and their partners, and the research and information that they need to improve outcomes for children, improve qualifications of the workforce. This study and set of work is part of a whole host of things that CELO is doing in order to bring new knowledge and new capacity to the field around how we can both improve the qualifications of the workforce, including teachers, teachers' assistants, principals, and administrators, and actually state leaders, and address issues of both compensation parity and teaching conditions. You do have the handout of the set of activities, but very shortly, in June, we will be convening with a number of state early childhood specialists and other leaders in Baltimore to talk about and share strategies to mobilize an exceptional workforce. And those materials will be posted online. We're also engaging with work with a number of states around looking at the cost of quality preschool, including the cost of having a well-compensated and well-prepared workforce, including sets of coaches and others. And another highlight for you, in partnership with the BUILD initiative, we are working with 12 state teams to help them identify the most powerful policies that they could move forward to improve qualifications and compensation of the birth to third workforce. So we're really excited about this today. I want to thank first all of the presenters, beginning with Diane, Deb, Marcy, Kat, Annie, and Steve. We really appreciate their time today. I know it's going to be extremely engaging. We want to also thank those that contributed and provided data for the report that will be shared in a moment, as well as Louise Stoney and Deb Mathias, who provided us with a review and some further feedback on the report. So we think, to the best of our knowledge, it represents broad input and new knowledge in this area regarding the workforce and workforce policy. With that, I am extremely excited to introduce one of our very valued team members, Diane Schilder, and she is a senior scientist at the EDC. She's one of our TA partners and leads, and the TA lead to Connecticut, and she will facilitate and moderate the webinar. So Diane, I'm turning it over to you and looking forward to a great conversation and engagement around this topic. Thanks, everybody.
Thanks so much, Lori. And again, I'm Diane Schilder. You can see my picture at the bottom on the left. And I am very fortunate to have colleagues present today who are not only national, regional, and state experts, but have in-depth knowledge of issues facing the early care and education workforce. Deb Adams will be co-facilitating the session with me, and Deb is with the Department of Early Childhood in Connecticut. Marcy Whitebook and Steve, as most of you are aware, are national experts with extensive knowledge not only of the field of early care and education workforce issues, but up-to-date information, and Steve will mention at the end some forthcoming publications, including the latest NEAR yearbook that will be coming out. Annie Rooney French and Kat Theodore are working. Kat works with a comprehensive center providing technical assistance to states, and Annie is an early childhood specialist in the State Department of Ed. So we're trying to make sure that even though this webinar has participants muted, we've got voices representing national, regional, and state expertise and perspectives. So with that, I'm going to turn to the overview of the webinar. The purpose of today's webinar is to provide a very high-level review of research on early care and education teacher policies. This is not an in-depth review of all of the research that's been conducted, but rather we're going to point you to some new resources and publications that hopefully you can draw on for your own work. And we'll briefly present some trends in state pre-K policies. We're fortunate to have, again, a terrific respondent panel to discuss the implications of the research for current policy and to reflect on our recommendations and next steps. In addition to the experts reflecting on the implications, we're very fortunate that we have Deb Adams presenting the work that Connecticut has recently completed that provides a nice illustration for how states can translate some of the current research into policy and to state plans. So our objectives are, again, just to reiterate, to present very high-level findings of research and new resources, to have an opportunity to reflect with state specialists, regional and national experts about the implications, and to provide all of the participants on the call with information about some really exciting new resources that are coming out from NEAR and others. So the next slide introduces a poll. Even though we do not have the lines unmuted, we will be presenting polls throughout to try to make this as interactive as possible. And so Jana is going to turn it over. I'm going to turn it over to Jana, who will discuss how the interactive poll will work. But we're really interested in hearing from those of you on the phone about the roles that you currently play. So I know that in some instances, people wear multiple hats. So if you can select the one item that best reflects your current role, and then we can have an understanding of who is on the call, and we can tailor our remarks to the range of participants. So it's in progress, if everyone can weigh in. Jana?
Yep. Thanks, everybody. I think that you can go ahead and respond. In this instance, I think you can choose more than one of the options that are listed here. So let's see if we can get everybody voting. We're about at 75%. I'm not sure that our panelists can see the poll, but all of our attendees can. So we'll give you another minute or so.
And as you're completing the poll, I recognize, and I looked through the attendee list of those of you who registered and recognize that there are a number of folks who work outside of these categories that we came up with. There are national policy experts. There are individuals working not only within as faculty or administrators in departments of higher education, but at a state agency level working across higher ed issues. So if you could take a look and pick the one that you think most closely aligns, even though I know we don't have exactly all the right categories representing those who registered.
I would just highlight for you that GoToMeeting and GoToWebinar, as adept as technology is, only allows 5 responses. So we put those responses knowing our audience that were most likely to be chosen. So we're getting up to about 90%. I presume at this point that that those that can't respond with any one of these 5 have chosen not to opt. So I'm going to close the poll, and I'm going to share the results just so you can see it quickly.
Terrific. So it looks like we have a pretty even distribution of individuals working within state departments of education, other state agency personnel, Child Care, Head Start, pre-K, and early pre-K, as well as other early care and education stakeholders and TA providers. I do know from looking at the list that there are a number of individuals who signed on who represent higher ed, but it looks like this is a slightly lower percentage. So given the range of voices that are represented, as we present the information, please keep in mind that we are going to give information that hopefully you can apply directly to your work, and it's designed really as what I think of as priming the pump, to give you some information that you can then take after the webinar to use and apply directly to your role as either a specialist or policymaker or TA provider. So the next slide shows that it gives a little bit of background. What we decided to do next is really provide some information about why this issue is important, and to think a little bit about some of the key resources that have come out recently and that you might be able to apply directly to your work. So in addition to learning a little bit about the roles that you play, we're interested in learning a little bit about your background knowledge. So if, again, you can select the one response that most closely matches your current experience, then Jan is going to open the poll in one moment, but we're asking specifically about the 2015 IOM NRC report. And if you can select the one that most closely matches your understanding of this IOM report.
It's not a trick question. We're actually leaping into this because of the importance of this resource. So we're really happy to hear about your understanding of the IOM report, and we're not going to leave you hanging, of course.
Dana, what's our response rate so far?
So we're up to 76%, and people are continuing to vote. Obviously, some folks have to think about it. They may be rustling through their pages to see if they can find more information, but we'll give it another minute. How's that, Diane?
Terrific. The reason we started with this question is because, again, we're hoping to tailor some of the information. And for those of you who are both very knowledgeable about the finer points of the IOM report, as well as those of you who have yet to know what it is, there's going to be information that we'll present that hopefully you'll be able to take and apply directly to your work across state agencies or higher ed, and as well as within the early care and education context.
So there still are a few additional folks voting. Diane, I'm going to give it another 10 seconds or so and then close the poll.
Terrific. So as Jana's wrapping up, we're going to take a look in one moment at the results. And I think what's really important here is that we have almost a quarter of participants on the call wondering what the IOM NRC report is. And in just one moment, Deb will give a high-level overview, and we do have some links not only within the slides, but also in the attachments that provide additional resources. As you can see, there are only a couple of folks would be able to recite the key findings, and in fact, we are very lucky on this webinar to have contributors to the report. And most of us are somewhere in the middle. So with that, we're going to turn to the next slide and briefly describe why this is important and how it set the stage for our work, really digging into issues of the early care and education workforce.
So
Diane, before we go on to the next slide, I do want to give a shout out to you, actually, as a reminder to all of us as your colleagues to not use acronyms without explanation. I want to throw that out because, in fact, as Deb gives us a little in-depth explanation about the report, Lori and I heard just a week or a week and a half ago, in fact, that the IOM is changing its name. So we may pipe in about that in just a moment.
Hi, yes, this is Deb, and thanks everyone for taking the poll on the what is the IOM report, and it's that big thick book. Mine is tabbed and well read. It's a thing that many people now carry around to take a look at and to be thinking about what to do with it and how to implement many of the great recommendations to highlight the importance of an educated, skilled, and well-compensated early care and education workforce. So Connecticut actually has utilized the report to do some work around core knowledge and competency frameworks, but also to think about the recommendations in the Institute of Medicine Transforming the Workforce report around our plan to address how to help people attain a bachelor's degree in early care and education specifically, especially around our state-funded pre-K system. And so with that, go ahead, Jenny, you can go ahead to the next slide. In general, I'm not going to read the slide, but to give you sort of a flavor, the first is about the what and the how of teaching and learning. And the recommendations of the report really kind of give some great ideas about the what and the how that teachers need to know and be able to do in order to be effective. And secondly, to be thinking about development of pathways and timelines towards reaching a bachelor's degree with specific competencies. And I think the stress here is about those specific competencies related to early care and education, and importantly for children birth through age 8. This isn't just one sector. This is about a continuum of growth and development for children birth through age 8. And thirdly, to utilize resources to support meeting the requirement. And that's not absent of compensation. It includes compensation, although the report did not get into compensation. But conversation swirling around compensation is a big key factor. But specifically to help states think about utilizing resources for individuals to attain a degree, but also about the capacity of our higher education institutions in order to help people meet the requirement. I recently attended a meeting in Washington, D.C. with stakeholders to discuss the structure and how to support the implementation of these recommendations. And so more information will be forthcoming to help states further think about all of these great recommendations, but this is just sort of like a start to really unpacking the report and what sort of we're focusing on today in terms of addressing an early care and education workforce. So with that, Connecticut had a specific charge.
Deb, can I just, this is Diane, and if I can elaborate very briefly, given that a quarter of our participants are brand new to the conversation about the IOM, and then we'll go back to the Connecticut charge. One reason that this report had such an impact is that while many of us who are working in early care and education are very aware of the research on the importance of a well-educated and skilled workforce, the Institute of Medicine and the National Academies have a great deal of gravity with regard to the policy recommendations that they issue. And so with the issuance of this report, it really brought attention to a lot of states and policymakers about the importance of having a well-compensated workforce that is educated. And Connecticut, as Deb's going to mention in one moment, was in a position to immediately apply some of the recommendations and grapple with how to take these broad, high-level recommendations and translate them into an action plan so that they could be realized in the next few years. So with that, Deb, I'll turn it back to you.
Great, thanks, Diane. As I said, it's a very large volume, and so it takes time to read and to take things one at a time. But specific to Connecticut, and again, I'm not going to read the slide because this looks quite ominous in terms of lots of things we need to do, but in a nutshell, we have a piece of legislation in Connecticut that basically charged our Office of Early Childhood to create a workforce plan that addresses assistance in obtaining a bachelor's degree, increasing salary, and look at retention. That's sort of what all of these words sort of say. And there's a backdrop to this piece of legislation that actually aligns quite well with some of the recommendations in the Institute of Medicine report. And the backdrop behind this legislation is framed in the existing piece of legislation that actually began in 2005 in Connecticut, setting the bachelor's degree as the benchmark for our school readiness funded programs in Connecticut. Through the years, the legislation has shifted to take a phase-in approach. So even though the legislation was in place in 2005 for an end date of 2012, we recognized in Connecticut that this was hard for everybody to meet without incentives and without a thoughtful plan. And so legislature over the years have changed the dates to phase in with an associate's degree to a bachelor's degree, and the new date is 2020. Also, there are some incentives that were put into legislation around 2012, 2013 to address specific monies for scholarship, very specifically pointed at this piece of legislation to help people attain a degree. And there was also legislation that looked at approving higher education institutions to offer a bachelor's degree outside of the context of what our state certification for public schools is. And I'll talk a little bit more about that in a moment, but I just wanted to give you a little bit of a context to this piece of legislation. It doesn't sit on its own. It's actually a larger backdrop about how Connecticut is approaching a phased-in approach to helping our educators reach a bachelor's degree by 2020.
And I think what's really terrific about the Connecticut context that's translatable to many of you who are listening in, who are in state education agencies and grappling with these issues, is that, as you can see, there wasn't one single mandate for Connecticut. There has been a long and rich history of a series of actions designed to address different aspects of the workforce, and yet the requirement to develop this plan prompted Connecticut to reach out to CELO, as Lori mentioned in the introductions. That state education agencies can reach out to the Center on Enhancing Early Learning Outcomes to provide technical assistance. And given this need to develop the plan, Connecticut reached out to CELO to ask for a collaborative project to work together to obtain information to address the legislature's charge. With that, Connecticut actually has developed a plan, and as a follow-up, we can send a link to participants if you're interested in seeing that, again, as a model of how a state was able to take these very broad recommendations from the Institute of Medicine and consider a very practical way of applying them within a state context. And in order to develop that plan, CELO provided some background information to Connecticut. We reviewed the existing research, a lot of which is in the Institute of Medicine report, as well as research that's been conducted not only by Marcy Whitebook and Steve Barnett, but others. We also performed secondary analysis of data from the National Institute of Early Education Research yearbook to look at changes. Both Jana and Lori mentioned that we interviewed our colleagues and experts not only at the national level, but those of you who are in state departments of education or early learning offices who are grappling with these issues. Many of you provided feedback to us, and then we summarized the findings so that it could be useful, again, to inform the development of the plan. So with that, next page. What do you think we found through all of this work? And again, it's another poll. And if you can turn to the poll, we're asking you to just guess. What do you think our biggest findings were? You can select one of the following, that either We found that requirements for pre-K teachers have increased in recent years, that states use a range of approaches to increase credentials, that pay parity is a challenge, or all of the above.
This isn't high stakes, obviously, but you guys are obviously pretty smart. I'll close the poll in just a minute. For those of you that are posting questions, I just wanted you to be aware that we will be having a Q&A toward the end. We will be collecting your questions. Some of them are being answered even as we proceed through the slides. One was whether the state plan engaged around reports in addition to the IOM report, and folks are very interested in what progress you've made from the point of your plan development, Deb, so keep that in your pocket. We'll give this poll another minute.
And one of the points as we go through, as again you're completing these questions, we did want to mention that in terms of the plan development, we worked very closely with Connecticut and provided resources, and the attached handout that is included not only in this webinar but again is available on the SELO website includes the summary of the SELO findings. And we encouraged Connecticut and encourage everyone who's participating on the call to use these resources. So borrow, cite, use to for your own purposes. The purpose of this report is not so that it will be just on the shelf, but rather to inform your ongoing development of your policy actions, etc. So with that, it looks like everyone, nearly everyone, guessed all of the above. Some guessed, it looks like one or two of you guessed, thought that pre-K requirements for pre-K teachers have increased in recent years, and some thought that pay parity is a challenge, but in fact we did find all of the above. And so to elaborate a bit on this, we're going to go to the next slide and briefly discuss some of the key findings. So this report that's available online includes a background section that reviews the existing research on why early care and education teachers should have not only bachelor's degrees but credentials and evidence of competency and skill. The information again that's on at the beginning of the report provides a high-level overview of these key issues. We also summarize research not only from Dr. Burnett and Marcy Whitebook, but also the IOM report, and present the key recommendations at the end. And next we present findings related to the current conditions. So again, we encourage everyone to look at the report, take what you can from it, and if you have follow-up questions, certainly reach out to SELO, and we're happy to elaborate on any of the findings. So with the next slide, I'm going to cover some of the issues that we did find, and I'm going to ask Marcy and Steve to reflect on some of these once I present the key information. Rick Brandon and colleagues, through a contract from the U.S. Department of Health and Human Services Office of Planning, Research, and Evaluation, recently conducted a very large comprehensive study of the early care and education workforce. These reports are available publicly and include a lot of really good detailed information about the conditions of the workforce. A lot of key questions. The next two slides briefly summarize the key takeaway, which is that educators working in formal settings have higher levels of education than those working in informal settings. So if you look from left to right, what you can see is that there are lower percentages of center-based educators or teachers with high school education or less. And you'll notice that unlisted, which is unlicensed family child care providers, there's nearly 47% currently have a high school education or less. If you go all the way over to a BA or more, you'll see that over a third of center-based early care and education teachers currently have a BA or more, compared to only about 20% of unregistered family child care. Next, this report
Diane,
pointed...
could I
yeah.
just highlight, we received a couple questions that I think you can, as you go forward, identify the colors are close. Sorry about that, everyone. The colors, we were strategic in trying to use our CELO colors, and they are very close depending on your screen. So if you could identify what's to the left, in the middle, and to the right on this particular slide. And we also received a question if you could clarify what you mean by unlisted.
Okay, yes, absolutely. So in terms of the colors, the bar to the furthest to the left for each of these clusters are teachers working in child care centers or preschool settings. So it's a center, they're working in a center-based environment. The blue bar, which is in the middle, 34% and 34% for the first two bars, are listed family child care providers. So these are family child care providers who are listed in a state licensing database. Unlisted are those who are providing family child care but are currently not registered and through a family and licensed through the state. So the Early Care and Education Workforce Study looked at all early care and education providers, not just those who are currently licensed. To answer the question about, so I answered the question about unlisted and then also about the colors. So the next slide will briefly show that preschool teachers have higher levels of education than infant and toddler teachers. So again, not a surprise to probably many of you on the call, but if you look, the very dark blue bar are the teachers working with 3 to 5-year-olds, and the lighter blue bar to the left are those working with infants through children who are up to age 3. And again, the workforce report provides this information, and for those of you who are interested in obtaining it, I have a link to it. It's Brandon et al. And this particular report is from 2013. They're regularly releasing more detailed reports that, again, can provide some really useful data for those of you who are interested in the conditions of the workforce. Any elaboration or comment from Steve or Marcy about the current levels of educational attainment of the workforce?
Hi, this is Steve. I'd just add that if you drill even further down, of course, the qualifications differ within sector, right? So they differ between private and public, with teachers in public programs having higher qualifications. I think that's true for early Head Start in the infant toddler sector, as well as for Head Start and state-funded pre-K. And of course, there's a lot of diversity, as you can see from these, you could infer from these data within the sectors, but there are still large sector differences.
Great, thanks so much, Steve. So what we'll see next, we actually drilled down and looked specifically at pre-K teachers next. Now, ideally, we would look at the entire early care and education workforce. Unfortunately, the way that the research is currently framed, we don't have data on infants, on teachers working with infants and toddlers through teachers working in grade 3. We have different data sources for each, but we're very lucky that NEAR has been collecting data over time on pre-K teachers. And so Deb asked us to take a look at some recent trends. And we reanalyzed NEAR yearbook data to look at changes in requirements for pre-K teachers since 2008. As many of you know, 2008 was the time of what we now refer to as the Great Recession. A lot of states were facing significant funding shortfalls, and so there was a question about whether the requirements for pre-K teachers actually increased during this time when we know that a lot of state budgets were very tight. And what we found from looking at the 2008 Near Yearbook and then 2014 is that, in fact, there was a big jump in requiring a bachelor's degree for pre-K teachers who were working in at least in some settings. As Steve mentioned, these are mostly public schools as opposed to private settings. What we found when we dug underneath the data is that often there was an exception for pre-K teachers in either community-based settings or provisions that allowed the bachelor's degree to be phased in over time for those who were, again, working outside of the public pre-K school, K-12, pre-K associated with a K-12 school. We also saw, though, an increase in requirements for bachelor's degrees in all settings. So again, not quite as large, and if you take a look and you think about the fact that there are 56 state education agencies, and the Near Yearbook actually collects data on all 50 states as well as the District of Columbia, and you look at these numbers, you can still see that we're really falling short in terms of the actual requirements for a bachelor's degree for teachers. So a lot of states are actually looking not only to Connecticut, but looking to other states to say, how are you actually then implementing this new requirement? What are the concrete steps that you're taking?
Thank you, Diane. This is Deb. One of the major reasons why we wanted this question to be included in the survey is that Connecticut has a mixed delivery model of serving our children, infants, through pre-K with state funds. And we wanted to try to address the unique challenges that perhaps this poses in terms of retention, compensation, and access to higher education in obtaining a degree, and the differences between the public pre-K sector in terms of that might be in public schools versus the community-based type of sector that may need different types of support, different types of, different variables of time, and these types of questions we need to grapple with in states that have a mixed delivery model in terms of helping to answer the question about the bachelor's degree, when and how. Thank you.
If I could jump in here, we did have a question. Actually, I want to make sure that it was answered. If I've heard both of you correctly, were there significant differences between state-paid versus parent-paid pre-K? I know that's a nuance, but perhaps between you, Diane, you, Deb, and you, Marcy, if you're unmuted, that could elicit further response.
Yes, thanks, Jana.
This is Steve.
Diane.
We have a survey we'll be releasing soon, which answers that question. And so, yes, there are clear differences between public and private, with public much more likely to have teachers who have a four-year college degree.
Thanks, Steve. I'm glad that you said that, because I was about to say that from our analysis, what we just looked at state-funded pre-K, so we didn't actually unpack that question, but this leads to, again, some really exciting new resources that are coming out of NEAR soon, and we'll provide some more information about that at the end of the webinar. So it's terrific that NEAR actually unpacked it.
I actually want to throw in here that the 2015 yearbook will come out exactly a week from today. And in addition to having these data updated, we also had a special supplemental survey on the workforce. So we'll be providing all sorts of new information about the workforce a week from today. Stay tuned.
So next slide, Diane.
Yes.
Okay.
And again, in light of Steve's comment, these numbers will change in all likelihood, at least slightly in the next week or so. But this kind of, for those of you who are working again on state policies, you'll want to look to the 2015 Near Yearbook to see what the current status is. But we also looked at credentials and certification. So our report that, again, is available as a handout, the policy report, talks about the fact that each state uses slightly different terms when instead of simply one broad term like a bachelor's degree. So credentials and certification can mean something different, but we tried to look at any specialized education that is above and beyond just the degree requirement. And what we found is that, again, there was a jump. Currently, 39 state pre-K programs require some kind of specialized credential or certification in early childhood. So we'll be interested in seeing what happens next week if that number actually goes above 40. And again, there is a special section on the workforce, so we'll look forward to seeing that.
This is Marcia. I wanted to just add something. Can you hear me?
Yeah.
Okay. Well, I think what's just interesting, stepping back from all of this data, if you go back to the IOM, and one of the reasons I'm one of the people who have read it is because I've been in a book group to read it because I couldn't figure out how to just read it on my own. So that's just a tip for people who are interested in dipping into it. But I think one of the real contributions of the Transforming the Workforce report is that it talks about the complexity of working with young children. You know, we're misled by the qualifications we ask people to have in different settings and in with different ages of children. And in fact, the complexity of the work to facilitate learning and development with infants and toddlers is every bit as challenging as it is working with older children. And I think that's something that we know that the systems we've built are not based on that assumption. And I think you see this in the data that you're providing here. And I think that what's striking to me is, if you step back from all this, is sort of the inequity that's built into our system around qualifications, that even in state pre-K, which has the highest qualifications overall, there's not even consistent qualifications for teachers in some states in both public setting, school-based settings and community settings that are offering pre-K. So I just think as there's just to keep that in mind, that to get from where we are to the IOM qualifications is a very, it's a heavy lift, no doubt, but it's also really an issue of equity here for kids that I think is embedded in our really variable qualifications for children based on the setting and the funding source and the age of children.
I think that's a really important point, and also one that, as we think about the infant and toddler qualification, and we look to the research from the Institute of Medicine that came out over a decade ago now that points to the importance of those early years and really high quality, enriched environments for very young children. What we're seeing in terms of qualifications is exactly the inverse of what the research might suggest where we should be really focusing our resources and supports. So that's a really good point, Marcy. And I also liked your point about the book group. For those of you who are, again, thinking about translating these findings, one of the things that I'm finding in working with states is that the states that are putting together work groups to really not only unpack the workforce report, but to think about their own plans. And they have very detailed, check-in, even if it's only for a short amount of time, weekly or monthly, to keep the plan moving. It can just be a way of really building the momentum, because if we look at these numbers, we could all feel very discouraged in light of the IOM charge. And yet, the states, and and Kat are going to talk about this in a minute, are really starting to unpack and grapple with these recommendations and think through what to do with them. And again, Deb will have a chance to give a quick overview of the plan that's been developed in just a minute. With that, I did want to jump into some of the ways that states are actually trying to change the current policies and conditions. And again, this poll, let's just give it a couple of minutes. We don't want to spend too much time, but what do you think states are doing to actually increase the education and credential requirements for early care and education teachers? 4 choices again: enacting legislation, issuing rules, regulations, enacting legislation, supporting tiered reimbursement, fully funding early care and education, or just the first 2 options.
Love you guys taking polls. I have to say there's a pause where everybody's thinking for a bit, and then it's like a bell curve.
So in terms of, one of the reasons why we're asking about this is that in working with CELO, Connecticut asked us to design a survey and collect data from state specialists. We heard back from 11 states, so not a representative sample, more of a convenient sample. And the states that weighed in, though, did represent each region in the country. We had a combination of large states and very small states, and we asked about what actions they were taking. We came up with some categories, and given that this was a new question and we didn't want to burden states by leaving it open-ended, we had a series of response options and had folks weigh in. So we know many of you are grappling with how do you actually make these changes, and how many do we have now, Jana?
And actually a couple have said that there needs to be a 5th response, none of the above. So if you don't answer, that we'll assume that your response is none of the above. So I'm going to go ahead and close, share the results.
Okay, and again, so many of you are anticipating the findings that are in our report or have already read it, and that is that states are actually both enacting legislation and, interestingly, supporting tiered reimbursement. I want to again thank Debbie Mathias for the conversations around the role of QRIS in workforce requirements, and in a moment you'll see the trends in terms of what states are doing. But unfortunately, in terms of fully funding early care and education, this is not the case. So what we're seeing across states is that they are taking a series of actions. We can move on to the next slide, Jana, to increase educational requirements, and yet the capacity of institutions of higher education across states varies substantially. I'm only going to take give a moment to this slide. What we're finding is that even though many states, as Deb pointed out, have legislation that's requiring enhanced levels of education, the capacity of institutions of higher education to support the early care and education teachers varies substantially. What we found from our convenient sample is that the states indicated that there are institutions within the state that offer early care and education courses, but the courses are not accessible for many educators in terms of the location and time. And again, Marcy's work has really highlighted this, and she's got some terrific profiles of states that show some of the challenges that are experienced in trying to provide education and credentials to the existing workforce. We also found that bachelor's degrees or credentials with a concentration in early childhood are offered for early childhood educators from those teaching at the infant level through pre-K. But again, the capacity to meet the needs of all teachers is insufficient. So there's substantial work that needs to happen with states working with their higher ed institutions to enhance the capacity to think about coursework that's both accessible in terms of the location, the timing, the medium, and also to create more coherent pathways. And this is a shout out to Massachusetts, because I know that both Massachusetts and Washington State have been engaged in some of this work. there are two different strategies that states are taking to really think about more coherent pathways. One is creating what states call stackable credentials. So rather than having a child development associate's degree and then moving from that to an associate's degree and having a big jump from the associate's to a bachelor's, to really think about some credentials along the way. Another step that states are taking is to really think about articulation agreements. So these are agreements to transfer college coursework from one institution to the next. And for especially states with many community colleges and early care and education educators who might take a course from one institution and then it's another institution provides a course. In the absence of an articulation agreement, it can be very challenging for educators to actually pull all of those courses together and lead to either a credential or a degree. The next slide.
Is this actually a poll, Diane? Did we already do it?
Okay, Jana, I think you were cutting out just a little bit, but let's move through this poll because it's already 2 o'clock and I want to make sure we have an opportunity to hear from the discussants. Another question that we asked was about the structures that exist that could be used to retain teachers. And again, what we found is that, and I'd like Deb to elaborate and Annie to elaborate a little bit on these different structures, both to retain teachers and also to support an educated workforce. Then on the one hand, out of 11 states, we saw that 10 had laws or regulations that required a degree. Some states are providing incentives in terms of scholarships, as well as guidance to programs regarding blended funding. The other structures that exist might be a workforce registry that can inform state policy decisions about how to allocate dollars and how to better and more strategically support the workforce. And then at the program level, some states are providing guidance around shared services agreements or tiered reimbursement that could be used to enhance the quality, the structural variables of quality, or to enhance pay parity. We did get some questions in our review when we sent the workforce report out for review, and I was really reflecting on these recently that if you notice, only a few states reported that they're using tiered reimbursement or shared services agreements to provide some additional funding for the system that could then be used to retain teachers. And the conversations I had with some of the experts is that, again, these can provide a little bit of funding or a little bit of an incentive, but when we really think about pay parity and we think about the conditions facing early care and education teachers, it will require a much more robust effort than simply providing a one-time bonus or a small incentive. And this is these are some of the comments that I received in terms of reflecting on these findings. Any further elaboration from, if we can move back just for one moment, Jana, from Annie about the conditions and the actions that you took, and then also maybe from Kat regarding your reflections on what's been happening within the states that you've been working on. So let's start with Annie.
Okay, thank you. You can hear me, yes? Okay. Well, with Kentucky, it was the State Board of Education that required certification for teachers, and what we found was that the higher ed didn't generate enough graduates to be able to do it in the time period that we had originally allotted, but then eventually, several years later, the universities, which all had the same certification program, which is birth to primary, special ed, general ed, then what we found was that once we required certified teachers, we went back to our regulations, and our lawyers told us that they had to pay the teachers in the state-funded preschool program on a certified pay scale. And our retention then went up to 89%, and it still is that way. So we were able to have a successful system, but in the state-funded preschool program.
This is
Annie,
Pat.
I also wonder, and I don't know, there seems to be a little bit of static on the line, so I don't apologize if folks can't hear me, but I wonder if you could talk a little bit about this notion again of both the requirement and then the incentives, and also Deb, the fact that even if there is a legal requirement, what really needs to happen in terms of translating state policy and action to achieve what's been mandated.
This is Annie. Did you mean for me to address that?
Yes, first if you can, Annie, and then
Okay.
I also was hoping that Deb could weigh in a little after.
Well, we just worked closely with everybody, the State Board of Education, the school districts, and we essentially told the districts you had to hire certified teachers after a certain date, but we also grandfathered existing teachers, and we allowed teachers that were not certified to stay in their position. So it was working with all of the systems combined, higher ed, the school districts, and statewide in order to be able to put it in. And we did have some additional monies from the legislature to be able to afford the teacher certified salary.
Hi, this is Deb. Thanks, Annie. And I think every state context is a little different, even though we all have political and fiscal implications in our states. To me, it's a balance between the stick and the carrot. And, we use legislation, laws, regulations, policies as sort of this stick. And I think on the ground what happens is we try to peel back what it says on the piece of paper and apply that to multiple contexts. And to Steve's point, around public school sector and community-based sector, and then you throw in infant, toddler, early Head Start, different age groups, it gets very challenging. And so how this works on the ground, you really have to be mindful of the multiple contexts and characteristics of the workforce itself. And I draw, a lot on Marcy's work regarding, the people. It's live people that we're talking about in context, and incentives such as scholarship. How is that really implemented? People don't necessarily go to school full time. It takes them longer to get an associate or a bachelor's degree than the average traditional student. They are working full time. What does that mean in terms of the dollars available for people to complete their degree? Do we have enough funds to support people through the entirety of their degree instead of one course at a time necessarily every other semester? Is one thing to consider. Blended funding. If in Connecticut we have 5 different public pre-K types of programs, very similar in nature in many of the standards, but different funding. How can we utilize funds in a better way that bring these programs together to look at a collective workforce across sectors, across age groups? So I think there's ways in which on the ground states could think about utilizing their policy, what's written on the paper, and think about the multiple contexts and what we're doing to people on the ground in order to really support them in obtaining a degree. And I know, Annie, you spoke a moment ago about certification. Connecticut, we don't require state certification as in a public school state certification, but we have a credential that is not for public schools, but it's based on the same NAEYC criteria, and we've built the capacity in our higher education system for the remaining of our higher eds that don't offer a state certification for public schools, but have a child studies degree to get a bachelor's degree and then have a credential that goes along with it saying that that bachelor's degree was modified to include the pedagogy and the practice needed in order to give incoming teachers and practicing teachers the experience-based learning and working with the children that they're actually going to teach. So I think there's multiple ways to do it, but I think we all need to be mindful of the different contexts and the different age groups in which we are working with.
So just an additional follow-up question that we've received in the question box is whether Annie or Deb, whether your 2 states have explored student loan forgiveness for early childhood education teachers. and perhaps we could ask folks in the audience if your states have explored this, or if Marcy knows of states that are taking a look at this, that you can raise your hand, or Marcy, maybe you could pipe in.
This is Annie. We have a Kids Now scholarship that was from tobacco money, which provides scholarships for people pursuing their bachelor's degree and then the certification, and that's mostly given to child care, and that's really been very effective. And we also have a traineeship scholarship that we are using for folks who are hired into the public school system who don't have the IECE, our interdisciplinary early childhood education certification, to pay for 90% of their tuition. So we cover it through grants.
This is Marcy. I think we actually are going to be releasing a report at the end of June called the State of the Early Childhood Workforce Index, and it'll be a state-by-state, information on all the states about the status of the workforce, and then looking very specifically at early childhood workforce policies that focus on access to education, work environment, and pay. And one of the things we are doing for that is looking at state-specific policies for K through 12 teachers around things like loan forgiveness and induction programs, and to see whether or not any of those are open to at least some people working in early childhood. So stay tuned for that roll-up. I can't tell you what the answer is at the moment. But I just to the other comments about, we have sort of I always think of it as like a hole in the bucket. I think states do much better on trying to help people they don't do enough, but most states are doing something, or a lot of states are doing something to try and help people with the cost of education. And in some states are doing really good, more comprehensive programs to help people really succeed in meeting their educational goals. But, we just have this hole because we're having people get degrees, and then as soon as they get those degrees, they often don't know on the front end, but they know once they do, that they're still going to be earning maybe 60% of what a kindergarten teacher is earning, and it's really in the state funded pre-K programs that have parity, where people are most likely to want to flock, although that's a small swath of programs in most states. So, if you look at the success we had in Head Start in helping people to attain degrees, like we have our muscles pretty toned in that area, and there's a lot of examples around the country about ways to do that. The problem is, on the other end about the jobs, and early childhood majors have the lowest, lifetime earnings of any college major. So, this is not a helpful recruitment and retention strategy for us. So I do think that, we have it's not that we shouldn't keep helping people advance their education. Absolutely, we should. But I do think that we have to really step up what we're doing around the compensation. And then I do think having state policies that direct people, that has to be a priority, at least on the pre-K side, is really an important way to start, sort of getting the gears turning to figure out how that can happen in a particular state.
Thank you, Marcy. Actually, I think that you've responded to a question we received about the complexity of this whole system and other variables, for example, younger, new to the field, early childhood education folks versus older early childhood education individuals who are already in the field and working and need to improve their credentials. Diane, I just wanted to highlight in terms of time, because we've been taking questions all along, and you've also been receiving requesting comments from your respondents, that we'll eliminate the Q&A slide at the end. So don't worry about that. If you'd like me to go on to the next slide, I will.
And I believe that we're nearing the end. And what I'd like to do, though, before oh, you're right about the discussion, both in terms of the discussion and Q&A. What I'd like to do, though, before I move on is two things. First, Marcy mentioned the forthcoming reports, and for those of you who are not familiar with the Center for the Study of Child Care Employment at Berkeley, Dr. Whitebook is the director of the center, and it's a fabulous resource for understanding not only what's happening in terms of compensation, wages, and the early care and education workforce, but also, as she mentioned, there's these terrific new forthcoming reports. I know many states are in the process of trying to, again, translate the recommendations into state-specific policies and practices, so those reports will be very useful, especially the information that's coming out around pay parity. So again, we'll include a link for everyone to the Center for the Study of Child Care Employment so that you can have access to those resources as well. And before I continue, I was wondering, Kat, I know you're currently on mute, but I was wondering if you could weigh in and provide a perspective about your work with the states, if there are specific actions that you've seen either related to scholarships or workforce supports that you would like to illustrate for the listeners.
Well, just right quick, I know we're running out of time. One thing that I'm seeing is just training teachers for really supporting them in passing the practice exam. So what one of my states is doing, they're having a boot camp summer to actually do a lot of professional development and training and help them to be able to meet those certification requirements. So that is actually coming from the State Department. So that is another thing that I really like seeing. The other thing is just, one other thing that I wanted to talk about is just the courses, the capacity really for training in one of my states, as with the budget cuts, you have universities actually closing their early childhood department. So that is really a concern with getting their teachers into the right location, because most of the places aren't close to them. But mainly just seeing them, my state, move to more providing the professional development needs that these teachers need, because many of them are coming from they may have a CBA or associate's degree, but just helping them to acquire the skills that they need to pass the certification test. And so, you know, I think that we do need to partner a little bit more with higher ed in looking at the coursework that that is required in early childhood. And because we have non-traditional students, people who are working in colleges, we need to look at those particular pathways and streamline them to what's actually needed in order to be a high-quality educator.
Those are really good points, Kat, both in terms of, just to reiterate briefly, the importance of really for the states working on these issues, if individuals working in either a State Department of Education or State Department of Human Services, to reach out and work with the institutions of higher education as partners to really think strategically about those pathways, to think about the hands-on experiences that can be provided, not only the example you gave around boot camp in the summer, but the job-embedded professional development that can build on the experiences of a full-time workforce and address the scheduling constraints that the teachers face. And then finally, to keep in mind that as we are looking to educate the workforce, as Marcy pointed out, these teachers are making 60 cents on the dollar of what a public school teacher would make on the one hand, but also a lot of the opportunities are being closed as public institutions are facing budget cuts. So to try to think about this proactively and take advantage of any lessons that are being learned from Head Start. I know that many states are now working with Washington University to look to some online professional development and coursework. I know that that's only one piece of the puzzle, but to really think comprehensively about putting all these pieces together to address the big challenges that are being faced. So the next slide that I'd like to turn to is just really briefly high-level recommendations from our report. And I want to again thank all of the folks who are on this call who weighed in and our reviewers for contributing to these recommendations. And I think the first, which is was something that came from quite a few individuals who looked at the first set of recommendations. They read almost as a series of policy trade-offs. And I know that for those of us working in a policy context, we often think about issues of either compensation or education as trade-offs, especially working with state legislatures that are facing very limited budgets. But in order to actually achieve the recommendations of the Institute of Medicine, it's very important to think of a comprehensive and coherent set of policies and actions that can ensure a stable and educated workforce. If we think of these as policy trade-offs, as Marcy mentioned, we might educate the workforce and then the teachers will go right into the public schools. Not that that's a bad thing, but we're not going to retain them in the early care and education setting. So we need to think about issues of parity and compensation, of structural variables of quality, as well as early care and education credentials and requirements really comprehensively. And what we see from our analysis is that the states that are addressing one issue tend to address a whole constellation. So sometimes it can be easier to really put these together as a basket of comprehensive approach. Very briefly, I'll go through the other points and then want to turn it over again to our panelists to elaborate on. And the next is to really take into account the existing levels of education of educators, and think carefully about the fact that the infant toddler teachers currently are starting with much lower levels of education and credentials than preschool and kindergarten teachers. Make sure that funding is considered both in terms of coursework as well as pay parity. Next, think through strategies that can bring more funding into the system, recognizing that cost sharing or tiered reimbursement as well as blending of funds could bring some funding into the system, but again, in and of itself, it won't lead to the pay parity that we know is really important for the retention of the workforce. And finally, the last set of recommendations are to, on the next slide, think about sustainable public funding. And there are a variety of models in place, and I'm actually working on a report for that's looking at financing, and Lori and Steve have done some terrific work on finance in the last year, and these materials will be forthcoming to really look at different sources of sustainable funding and to think about what the cost of early care and education actually costs. Finally, a couple of other recommendations that came from the states were to systematically review all of the legislation rules and policies that are in place to address some of the gaps that might exist and think through a way of crafting a more coherent set of rules and regulations. Both Kat and Annie mentioned, well, and Deb, so all of our panelists mentioned the differences that can really present themselves to teachers. So a teacher working in a community-based setting in which there are Head Start funds and child care funds and pre-K funds can actually be subjected to a range of rules and regulations regarding workforce requirements, and to really try to streamline and align these can be one really important step, and again is a recommendation in the Institute of Medicine report. And finally, to think about both the collaborations at the state level with institutions of higher education and consider the overall quality of the workforce. So with that, I'd like to turn to the final slide, Jana. And that is to get any final questions and discussion of what's next. Last remarks, we've got just about 5 minutes before we turn to, again, to the slide that shows additional resources for those of you who are listening in. Steve,
so Diane, I would, we do have a couple questions and a highlight. I think you were just about to say that Steve had to leave us. It was great that he was here for a few minutes, and we'll all stand by for next week's release of the yearbook. We have a couple of questions that I'm wondering if it's okay if we pose quickly to the panelists.
Absolutely, that's great.
Sure. So a couple questions related to both compensation but also content of the early childhood education faculty systems across the country. Marcy, you may be able to respond to this if you're with us. Kat actually alluded to this, that our higher education institutions may indeed not have the content that is going to be best applied to the classrooms that our matriculating students are serving. So I think that you all have done, or you would be aware of a study of the content of the higher education programs for early childhood education across the country. Can you respond to that briefly and let us know at least the direction we need to look?
Marcy, I know that you have done some work in this area. Your center has.
Yes, I thought I would. Can you hear me? Yep. Okay. Yes, we have a tool called the Early Childhood Higher Education Inventory, and we've used it in 7 states, and we have 5 or 6 states coming up that we'll be doing next year, and starting in the fall. And what this does is look at course offerings around a variety of topics, both on the developmental side and sort of the pedagogical side, but we look at it whether or not these things are covered for infants and toddlers, preschoolers, and children 5 to 8. We also look at field-based opportunities or field-based learning, and then we survey faculty and learn about some of their beliefs and attitudes, some of their professional development needs. And there's some striking things that have come out of the 7 surveys that we've done so far, inventories. And basically what you see is, less content on infant toddlers than on preschoolers and older children, and very little focus on leadership, both pedagogical or management kinds of focus. So we don't have built into our early childhood program some of the leadership things we need. And and some issues around how to work with children who are dual language learners seem to be surfacing a lot as a concern of faculty. And for many faculty, we hear concerns about working with a diverse student population as well. I think what's really striking is the challenge around applied field learning, which is so important in teacher preparation, that many of the programs for early childhood programs don't have robust opportunities for students. And of course, that's made even more difficult in light of what someone was saying about, how many people are going to school and working full time. And then there's some issues that also come out around sort of who the faculty is, which is, older, predominantly white, many of whom haven't worked in classrooms in a long time, and really with the question of what the leadership and teacher education pipeline is in states. So they're all listed on our website. There's a review article called Taking Stock of the States, I think is the title of it. It's right on our homepage. And you can also follow up with me if you have more information about the inventories.
Thank you. Just as a highlight within the report, which is in the handouts and also will be posted with these materials, is already posted on our website, is a lengthy resource list that will also connect you to Marcy's center. other last-minute comments from folks on the line, and Lori, also you may want to pipe in here. I think that you'll have to unmute yourself, but.
Well, I am just absolutely amazed at really both the breadth of the information and the challenges we face, actually. It's a really complex topic. I really, again, thank everybody on the call, both the presenters and the contributors for contributing to the conversation and getting us thinking. I think it's a perfect backdrop and preparation for our annual roundtable that will allow at least some of us to come together again and probe much more deeply into the information that was presented. I think many of us are engaged, many of us on the call and many others that didn't get to join today, in continuing to address the workforce. I think it's probably the one, the most urgent issue of our time. And this webinar really focused a lot on the birth to age 5 workforce. I think we also have to, continue to think about and challenge ourselves and connect issues of the K-3 workforce, not only teachers, teachers' assistants, and principals and other administrators. And I know we'll be looking at that again in our next year as well in SELO's TA. So I thank everybody. I think we would love for you to continue to engage with us, and we will continue to try to provide you with resources and be a thought partner and an advisor as you move forward. So I'm really pleased and so thankful for everybody for participating, and turn it back to others for any comments.
So I would just definitely like to thank our state folks and Kat as well, our Comp Center partners, which is really where the rubber hits the road and the work is getting done against tremendous challenges, as Lori has highlighted. And I say this before handing off to you, Diane, with a big thank you for taking us on this research journey and holding hands with Deb and the other state respondents as well. And we'll give you the final mic and move on to the resource page.
Thanks so much, Jana. And again, I just want to give special thanks to Kat Theodore, who's working with a couple of comprehensive centers and AIR. And for those of you who are working in state departments of education, again, please reach out to us at SELO as well as to Kat. I want to thank Marcy and Steve for their terrific contributions. And I also really want to thank Annie for her contributions, not only today, and Deb for your contributions, but to the report that we produced. Again, it's designed as a high-level set of resources. So today's webinar was to kind of prime the pump to provide you with a set of resources and tools, some contacts, and we encourage you to follow up with us personally and also to look at the report, borrow from it, copy, cite it heavily, post it on your website, or make it your own. We're here as a resource to support the work of all of you who are working on these important issues, and we are very grateful that you both listened in on today's call and very grateful to our contributors. So thanks so much. The very last thing I wanted to mention before we turn it over is that we mentioned that our annual meeting is coming up in June, and all of the resources associated with this meeting will be posted to the SELO website. So even those of you who will not be attending the Early Childhood Specialist SELO annual meeting, please look to our website, and all of the materials, again, are in the public domain. They're available. We would encourage you to look through them and use them as they can best meet your needs. And again, a shout out to the Near Yearbook that will be coming out a week from today, and also to Marcy's upcoming publications that will provide very useful resources to all of us working on these important issues. So, thanks again.
Thank you to all. Bye-bye.
Thank you, everyone.